Do you want to make a difference in the health and welfare of others? Are you a good student with an interest in lifelong learning? Do you have good people skills? Then you may want to examine a career as a family physician. Family physicians are licensed to diagnose and treat patients' physical and mental diseases, disorders, injuries, and other health-related problems. They work in a team environment, and where necessary, they refer patients to specialists. We spoke to a family physician working in Alberta to diagnose the details of this important career.
Hi, I'm Graham, and I'm a family physician. Job as a family doctor is kind of the general person who gets to help people with their day-to-day medical issues or health issues. In my mind, my role is to figure out what's going on for the patient. You're trying to help people maintain their health and watch out for health issues in the future. Family doctors work in a wide variety of environments. Clinic is kind of probably the most classic place you'd think about seeing a family doctor. There's a lot of family doctors who work in the hospital setting as well. And then you'll also see some in long-term care facilities taking care of patients as they age. Some of the other places a family doctor can work are medical research, military service, administrative offices, and public health as well. When I get to work in the morning, inevitably I open up the task inbox. So those are kind of the inbox where people's lab results or imaging results have kind of gone for me to review. There's always a big pile of them to go through, so you spend as much time as you've got before patients arrive, and then you've got your first patient of the day. It can range all the way from 10 patients in a day up to 25, 30, and it's anything from a simple prescription refill to physical exam to, small surgical procedures throughout the day. Some of my other medical duties are to take medical histories, refer to specialists when appropriate, and adhere to professional standards of ethical practice as well. Really, we just want to get some. The physical requirements can be very low, but they can also be as much as you want them to be. For the most part, in the interview environment, you're sitting and chatting and interacting in a comfortable manner, but you do often have to examine patients where you may have to help them up onto the exam bed. You want to be there as a stabilizer in case there's any issues with a patient's mobility or anything along those lines. The doctors in the hospital, they're rounding all across the whole hospital often, seeing patients in various different areas. So it sort of depends on your environment. That looks really good. The working conditions are quite good as a family doctor. The big benefit is you're your own contractor. So you can somewhat set your hours, you can decide how many hours you want to work every week. How long has it been there? For the most part, I find family doctors work 3 to 5 days a week, but 4 being the common average, with another day set aside for doing those extra tasks or more administrative roles that a doctor might have. And then there can be some weekend work, but that's usually up to you. For personal protective equipment, we sometimes will wear masks. We all have a lot of experience with masks after COVID, but it's still an important tool to use in the clinic environment. Often we have gowns as well for the same thing, and then for different exams, we've got gloves and that kind of a thing as well. Breathing normally. Medical school is a lot of schooling. For most people applying to medical school, they will have completed a 4-year undergraduate degree. Medical programs in Canada are quota programs. Applicants are selected based on a number of criteria. Not all of the eligible applicants will be successful in their application. The applications can include academic performance and interview results, application letters or support letters from previous experience, and then the results of medical college admission tests or an MCAT score. Once you're into medical school, it's another 4 years, with 2 years being in the classroom and 2 years more in a clinical-based environment or a hospital-based environment. At that point, you graduate with a medical degree, but you have to go through a residency program. Let me tell you about your results. It can be quite a lengthy period of time in school. I generally would recommend that people enjoy school if they're thinking down this road, or at least enjoy the act of learning. There's many great aspects of being a family doctor. One of the best ones is building a relationship with your patient, seeing that patient grow and change over time, from a health perspective, from a medical perspective, and just from a friendly perspective. It's nice to see people through their lives and be a part of helping them overcome some of their challenges. In my opinion, that's the strongest thing that a family doctor does. You meet real people in their normal lives and try to affect positive change. And that's a really inspiring thing to get to do.
To practice as a family physician, you must have good listening and communication skills and emotional strength and maturity. The ability to problem solve and inspire confidence in others is also vital. If you have good stamina and teamwork skills, then you may have all the symptoms for a career as a family physician. Check up on the details and find out more about this occupation, including training requirements and salary ranges in the occupational profile on the ALICE website. While you're there, check out some related occupations, including nurse practitioner, optometrist, or dentist. Explore the possibilities. Go to alice.alberta.ca.